Good morning, everybody. Today's topic will discuss about what are the causes of failure of IUI. You know, the IUI meaning intrauterine insemination. It's a very simple procedure. Produce one or two eggs in women by giving tablets or injections. Once the egg size is good, means dominant follicle of size 18 to 20 millimeter, that day we will give injection HCG for triggering injection, that is rupturing injection. That day we collect your husband's sperm and wash it, filter it, best sperms will be put into the uterus. This is called IUI. It's a very day-to-day common OPD procedure, and everyone will be like asking, what are the causes of IUI failures? Doctor, I did 2 cycles, 3 cycles of an IUI, 6 cycles of an IUI, but it is failed. So we'll discuss few points before knowing the causes of failure of IUI. See, to get a success of an IUI, what are the important things? The woman should be young, means below 35 years, success is better, and both the tubes should be open, and uterine cavity means where the baby growing area should be good, and she should have a enough number of eggs, at least minimum above 5 anterior follicles should be count. So this is in the partners, that is wife's positiveness bringing the IUI success. And the husband sperm count should be about 10 million with progressive motility of even 10% above is enough, because and morphology should be about 2%. If that criteria fits, the success will bring you more. So what are the causes of IUI failures? One is woman is producing good enough number of eggs or not. What do you mean by enough? You don't need so many eggs for the IUI. You need best 1 or 2 best good eggs. That is very important in this, because you should not produce 2 or 3 or 4 or 5. Whenever there is more number of egg production, we always cancel the IUI cycles, because failure is more and complications with IUI in that cases is very, very problematic, because we will have multiple pregnancies. There is a risk of hyperstimulation, OHSS syndrome will be coming up. So always the aim of IUI is produce 1 or 2 best eggs. That is very important. So if the woman is producing good number of eggs, the success is better. And the production of and the egg production depends on the age of the woman. It should be below 35 years, above 21 years, and her weight and height should be correctly, means body mass index should be below 22 or 23, not too obese like 25, 28 and all, and not too much thin. So you should set a criteria. So many times we find a patient with polycystic ovaries, there is a risk of hyperstimulation, and too obese patients, they not respond properly and they may not produce the good eggs. And the AMH should be between 2 to 5. AMH, anti-Mullerian hormone value, should be above 2 and below 5. That means there is enough good quality of eggs will be produced. So this is very important. Second is, during the stimulation, that means during the tablets and injection taking, your lining should grow properly. What is lining? The endometrium of uterus layer where baby comes and attaches, that's called endometrial thickness. It should be above 7 millimeter, minimum above 7 millimeter and below 13 millimeter. So in that, if it comes now, very good success. And it should be triple line, means 3 lines will be seen, which is a good indicator of implantation is 80%. That means where the baby growing attaches to the uterus is very high. So that you have to ask your doctors, or you must check during the scanning. Always see that, or take the reports of the scanning picture or the written documents from the doctor that all the criteria fits or not. So this is about the woman. And before going for an IUI, you must have your patent tubes. Both the fallopian tubes should be open. Even if it is one is also good enough to get a success. That is very important. The fallopian tube opening, how do you check? That is by X-ray, HSG, or by laparoscopy, histoscopy. That you should do it before the IUI. So these are the positiveness which brings the success of an IUI. This is about the female partner. And male partner, he should produce the sperms at the clinic. Always remember that semen collection should be in the premise of the unit where the doctor you see. don't do and bring the sample somewhere else and get it here, because the transportation and preparation there, it will hamper the quality of the sperms, and the motility, morphology, everything will change. The collection center to the IUI andrology clinic should be very short distance. Once after the collection, you give the sample to the andrology clinic. There only they will prepare, and after the preparations, they say it may take 45 minutes to 1 hour depending on the viscosity of the sample and the count and motility. We decide what methods to be done. There are different types of methods of preparation of the semen that clinicians and the endo technicians will decide to get the more success. So in average, in our clinic, as an IVF unit is there, we use best media for the preparing the semen. That is also important, because the success of an IVF depends on the what media you use. Means media is nothing but a nutrition to the sperms, which makes the sperm quality and the motility 100% active. So that's how the success improves in the IUI. So these are the causes of the failures of the IUI. Once it is collected, sample is prepared and put into the incubator. After 1 hour after the preparations, we incubate for around 15 minutes, so that temperature will rise the motility and the good motile sperms will come up, swim up technique, and then we take 0.4 to 0.5 ml and inject immediately into the uterus, and the distance from that to injection of the means to your wife should be shortest. You mean to say here the success depends on the duration of collection, preparations, and to the patient end, that is about the insemination into the uterine cavity. So these are the very important points for the causes of the failure of the IUI. And comes the technique. How do you do, that is also important, and what catheter you use. Catheter means the one with a syringe attached with a long tube which goes into the uterus very smoothly, and it should be atraumatic, and we don't give any anesthesia during this time, and she'll be awake. We'll clean the uterus mouth with the saline, and then we remove all the plugs, disinfectants, debris, infections, everything, so that while passing it should be very atraumatic and aseptic. It should not carry any infection into the uterus. That is the main motto of IUI procedure. And putting a cusco speculum correctly and putting the mouth of the uterus in the center of the cusco speculum makes the cervical canal, that is a passage, very smooth. That is how the technique will be, and it should be very, very atraumatic. You mean to say it should not bleed, any drop of blood should come out, because once the blood comes, it will decrease the motility of the sperms. Blood is an enemy for the sperms. So that is why the technique of insemination by the clinician also increases success. So these are the many important points. And after, once you put into the uterus that catheter, slowly we inject. We take 1 to 1.5 minutes, 2 minutes to inject slowly. We should not inject rapidly, so that the uterus will suddenly distance and causes a pain, cramping pain. And once the pain comes, mother, means your wife, will feel much painful on the surroundings, and it causes uterus will start contracting. It will expel all the putting the sperms outside. So it is very important during the procedure that how the doctor injects, how many minutes it takes. That is very important points about the success of an IUI. After the IUI, we give medicines to get the implantation of the embryo into the uterine cavity. So minimum 2 weeks we give, 15 days. That has to be followed according to the doctor's prescription. One will be tablets, other one is either capsules or pessaries will be there. That is put every day. After 3 weeks, we'll come to know the results, positive or negative. So this is very important. Once it is positive, we have to come to the hospital regularly and do the urine pregnancy test. On that day, we'll be doing a blood test, beta HCG. That's how we can confirm the pregnancy. So during this time, in the 14 days or 3 weeks, you may get some cramping pain or sudden pain. That is all complications. Sometimes cramping pain is okay, but pain persists. You must visit the doctor, because during the stimulation, that means during the tablets and medicines injections, sometimes you develop more eggs. Once the pregnancy comes, there is a risk of hyperstimulation will be there. That has to be notified to the doctor and come and visit. Doctor will give you proper medications and will take a precautionary measurements that how to tackle the complications. And very important is not to produce more than 3 or 4 eggs. Suppose if you get a 2 eggs rupture, there is a risk of twins pregnancy or triplet pregnancy happens, and this multiple pregnancy is also one of the complications. And the procedure of IUI aseptic should be there. Sometimes if you don't prepare the samples, you will get a infected sample go into the uterine cavity. You will have a pain on and off, on and off. Sometimes it causes pelvic inflammatory disease, pelvic abscess formation, sometimes tubal fluid accumulation, hydrosalpinx, biosalpinx, all complications which leads to the negative of the IUI. So it is a procedure, very simple outpatient procedure, and it doesn't need any anesthesia, and it should be done in the clinical premise. That is very important to get the success of an IUI.